and only basically is you use the 3 C's. First thing you do is you check to see if they're awake or if they're alert. And if they're not, you go to the next C, which is you call for help. When you call for help, most of us have a cell phone. Call 911, put it on speaker, kind of put it button next to the patient, and then that way you can talk to the operator as you go on to the next step, which is compress. Doing compressions, the goal is non-stop compressions. You want to find your landmarks, which I'll show you, and you want to push, and you want to keep pushing until help gets there. All right, so if you find somebody that's laying down and you're not sure if they're alert or if they're in cardiac arrest or not, first thing you want to do is come up to them and you want to touch them and find out if they're awake or not. Put your hands on them, shake them gently. Sir, ma'am, are you okay? Are you okay? If you don't get any response, especially if you notice they're not breathing at all, step 2 is going to be to call for 911. If you have a cell phone, call 911 there. Of course, if you don't have a cell phone, you're going to need to leave. Go to a neighbor's house, go to a payphone, whatever you got to do, and call. We got to get the ambulance going. Step 3, and the final step, is going to be to compress. You're going to lift the patient's shirt up to find the landmark. Landmark's going to be between the nipples, center of the chest. Take the bottom of your hand, and then that's the place you want to put your hand. Don't put the palm of your hand in the center, because that's not what you're pushing with. You're pushing with the bottom of your hand. So you're going to put the bottom of your hand in the center of the chest, interlock your other hand over it, and then compress. Now the rate that we want to compress is about 100 times per minute. Some have think of the song Staying Alive in the background. That song's about 100 beats per minute, and that's the area we want to be at, 100 beats per minute. And you want to do this uninterrupted until help arrives. So once you're doing the compressions, you're going to realize after about 2 minutes, you're going to be feeling pretty fatigued. So if you have somebody standing around you, whether they know how to do this or not, you can explain to them while you're doing the compressions to come down, put your hands in the middle of the chest, lock your elbows, keep your shoulders over the hands, and push. And then you can take turns.